Hi, everyone. Welcome to today's session of Aesthetics and Wellness by Dr. Yusra. On this podcast, I am joined by Milad, the CEO of Mastelli Dermafocus, who are the makers of polynucleotides. And yes, this is a buzzword. These are the new injectables that are used for regeneration, and they come from fish sperm and testicles. So lots of wild and wonderful things. We've talked about how they were formulated, how they were found, how they're made, where they can be injected. And I am talking from top to toe. So we've talked about how polynucleotides can be used for regeneration of hair, treatment of hair loss, skin rejuvenation, how it helps you to not just look younger, but actually help improve the function and health of the skin, and also of its use in intimate female health, i.e. down below. If you want to learn more, please tune in, and I hope you enjoy this episode. Thank you. Welcome to the Aesthetics and Wellness podcast by Dr. Yusra. Today, I am delighted to have CEO Milad on our podcast. He is the CEO of Mastelli Dermafocus, makers of polynucleotides. Now, polynucleotides, for those of you who don't know, are the new buzzwords in aesthetic medicine. And they are a treatment modality for regenerative health, for regenerating collagen, for anti-aging. And the interesting thing about them is that they come from fish sperms, fish testicles, and people find it really weird when I say that.
Yeah.
So tell us more about that.
Sure. Yeah. First of all, thank you for having me. I'm delighted to be here with you today. And polynucleotide, as you rightly said, they are the one of the most popular treatment in aesthetics at the moment, and they are buzzing and everybody are talking about it. So polynucleotides, they are not new. They've been around for a very long time. They've been used in medicine for over 70 years now.
Incredible.
So they initially started for wound healing and in plastic surgery and scars to promote the wound healing. And more recently, they've started using it in gynecology, aesthetic medicine, and also orthopedics. Mm-hmm. So in terms of aesthetic medicine, it was first launched in Italy in 2005, and it's been in Italy they've been using it for a long time. In Eastern Europe they've been using it for a long time, but it's relatively new here in the UK.
We're always a bit slower in the UK to bring things in. I mean, I was surprised to hear how long it's been around. Actually, I was reading up about it, and it's been used in general medicine, plastic surgery, wound healing for such a long time, and it's not just a fad. That means it's not a trend like many trends that we see that will come and go. This is actually scientifically evidenced and has robust data behind it and huge amounts of clinical research and experience. So we know that it's here to stay.
Exactly.
So,
and yes, that's 100% correct. You know, there have been more than 100 published clinical studies and many, many, many other articles about the safety and efficacy of the product and the molecule. So it's safe, there isn't any adverse reaction, it's a natural molecule that is part of our body already. And it's beneficial in benefiting the skin in many different ways. And that's why one of the reasons that it's popular these days in the UK is because of the safety, the benefit that it gets, and the natural result that the patient will receive.
So tell me about how they found it in the first place. Because every time I say to patients, when they say, what is it? And now, it is the buzzword. It's out there. Yes. People are talking about it. It's in every other paper. And then when we talk about where it comes from, they're a little bit taken aback.
Yeah, it's a bit, everybody giggles now.
Yeah.
So polynucleotides, they generally derive from salmon sperm or salmon trout gonads. And gonad is a word that I had to learn recently.
Basically testicles.
Testicles, yeah. And so the reason that they use fish is because fish is got the closest DNA to human DNA, and it's very compatible. And sperm or testicles, they've got the highest source of DNA, and it gets extracted from the sperm, and it goes through a high purification process. So all the proteins, all the peptides, and every trace of fish is removed. So we end up with pure polynucleotides and nucleotides that are part of our naturally found in our body and in our cells. So although it's derived from fish, but it has no traces of fish in it.
So does that mean if a patient is allergic to fish, they can still have it?
They can still have it, and it's very hard to find a patient that has allergy to fish, especially trout fish.
Yeah.
People usually are allergic to shellfish.
Yes.
And usually, I mean, on paper, theoretically, it's fine. It's hard to do clinical studies because, there aren't that many people that are allergic to fish. So the advice is always to do a patch test and make sure the patient is fine with it. But there hasn't been, we're talking about in aesthetic medicine about 20 years of experience, and there hasn't been any single adverse reaction so far, even with people that have allergy to seafood and fish. So it's safe, but obviously it's always advisable that practitioners do a test and make sure that the patient don't react to it.
Yeah. I mean, I always err on the side of caution, and we have these discussions. Naturally, as medical practitioners, we're not gung-ho and we want to be extra safe, and we will always test these things. So they come from fish testicles or fish sperm because they're very high in DNA. And then they are purified, ultra-filtered, highly purified strands of ribonucleic acid. And our bodies are full of ribonucleic acid. So when you inject these little strands of DNA into our RNA, into our skin, the body is stimulated by that.
Yes, so it initiates the healing response from our body, and all of this is done naturally through our own body's ability, because you can class it as a regenerative treatment because our body can respond and regenerate. But as we get older and older and older, and that process becomes more difficult. So polynucleotides are, if you like, is the food for our skin. So if we're feeding our skin with the right nutrition, everything that it needs to heal properly and start the regenerative process. So when it's injected, they work on a cell. They work on a cell called fibroblast.
Yeah.
And fibroblast is the cell that is responsible to make collagen, hyaluronic acid, elastin, and everything in our skin. And when polynucleotides are injected, they increase the fibroblasts, but they improve the existing fibroblasts as well. So that means that we have both, in terms of quantitative and qualitative measures, we have better fibroblasts and better functioning cells.
So this is the key, because fibroblasts are the key cells that formulate basically our skin, really.
Exactly.
So they formulate our collagen, our elastin, our hyaluronic acid. Collagen is a peptide or a protein, the most abundant protein in our body. And that doesn't just help with, people always think collagen is for aesthetics, or it's what keeps us looking youthful.
Yeah.
But actually collagen as a protein is important for cell signaling, wound healing, cell proliferation, migration. It's one of the most important proteins and is present all over our bodies, from our hair to our skin to our joints. Collagen is vital, and there's various different types of collagen from, in our skin you have type 1, type 2, type 3, type 5, type 7 collagen. There's all types. Each one has its own responsibility and function, some for making sure that our epidermis is connected to our dermis. But the key fibroblasts are sitting at the basement membrane, which is in our dermis. So this comes down to where we're injecting it as well, right?
Yes.
Because I have a lot of patients that say, well, can you inject it deep, or can you inject it into using a cannula? And whilst, yes, sure you can, where you really want it is in the dermis.
Exactly.
Because we are targeting the fibroblasts. Those are our target cells, so to speak. And as we age, we know that we're losing collagen. We're actually aging from 25.
Yes, and that was something that I found recently.
Right.
And it's very interesting. And that's why polynucleotide is a treatment that it suits every age and every patient, regardless of their age and the damage that they have. Because if we're younger, in our late 20s and 30s, that's when we start aging, but we don't necessarily see it. So that's where polynucleotide comes in, and it acts as a preventative treatment. And that's very important, because so far in aesthetics, majority of the treatments have been corrective.
Correct, yeah.
Now we've got a preventative option for the patients that we help them to age better and more natural as time goes on. Because, there's nothing that we can do about aging. We can wait until everything gets to a worst case and then start correcting it, or we can start preventative treatments from early age to improve those cells, to increase the fibroblasts, to increase the collagen and elastin and hydration in our skin.
So are you saying from the age of 25?
Yes.
Okay, so it does two things. One, it wakes up the existing fibroblasts, so to speak. So we're preconditioning those fibroblasts. We're making them a little bit more active again, but then we're also recruiting new cells to the area. And I think that's the key. That's the fundamental. Because what I do in clinic, and I do a lot of device-led treatment, I do a lot of regenerative medicine. And I think regenerative medicine has actually been around for a long time.
It has, yeah.
You know, people have been using PRP, polynucleotides in plastic surgery, wound care, osteo, orthopedic surgery for such a long time. And it's only just now trickling into aesthetics. But rightly so, because actually what we're trying to do is press pause and rewind on the aging process. But also we understand that aging happens for a multitude of different reasons. There's actually 12 hallmarks of aging.
Yeah.
One of which is inflammation.
Exactly.
And inflammation is the root of all disease, right?
Yes.
It's a precursor for all disease, including promoting aging.
Yeah.
And what we now know is polynucleotides not just help with fibroblast recruitment, so bringing more of these collagen-producing cells, not just waking up the existing fibroblasts, but also recruiting endothelial cells, which is angiogenesis, which means new blood vessels. So if you get new blood vessels, you're getting a whole host of new oxygenated blood to the area. So you're increasing the health of the tissues. And then you're also reducing inflammation. And if you can reduce inflammation, then you're prolonging health as well. And ultimately, that's what we really want to do. The first thing that I ever want to do in my patients is reduce inflammation systemically in their body and on their skin. Because if I'm just putting filler in and I'm not reducing inflammation, well, what's the point? I'm putting a plaster on things. I'm masking aging, but actually they're still aging on top of that. Yeah. So polynucleotides don't volumize. They're not dermal fillers. They won't change the shape of the face. They won't create new volume, so to speak, but they will really improve the health of the skin, the condition of the skin. And that's what we call preconditioning and can be used before a device-led treatment.
Yes.
So I teach a lot, I speak a lot, and people ask me all the time, so what should I do first? Should I have microneedling first, or should I first have a regenerative procedure? Should I have polynucleotides? Yeah. And the answer is always regenerate your tissues first, because if you've fertilized your existing fibroblasts, and if you've brought new fibroblasts to the area, then you do the microneedling, then actually all those fibroblasts are awake, they're activated, they're laying down new collagen. You then create a wound via your microneedling. Now you've really got an even better deposition of material.
And this is one of the cases of use of polynucleotide, because they can be used alone, but they can be combined with many other treatments that aesthetic practitioners already do. And the idea is that if you prepare the skin, if you prime the skin, and you build the fundamentals, the skin is healthier, quality is better. Any other procedures that you do, you improve the longevity of the treatment, and the result will last longer. The patient will be happier. The downtime will be less. And the thing with aesthetics treatments now is that patients are not looking for single treatment options. It's multiple different things. They have multiple different concerns, and the skin quality is the main one. You have to always fix the skin quality before considering dermal fillers or volumizing and things like that. So building that relationship with patients and giving them a treatment options, a journey is essential. And polynucleotide, it works very well with that, and it gives you all the practitioners and the patient an extra tool in what they're already doing.
Agree. So I want to go back to basics, and then we'll come back to where we can use polynucleotides, because polynucleotides are used, we already know they're used in wound repair. They're used for preconditioning skin prior to having device-led treatment. They're used to improve collagen. And actually, I've had polynucleotides, so I'll talk about my own journey. But I want to go back to how it was first found. Who thought to go and take polynucleotides, or who thought to take these fish sperm and inject them into someone?
Into the skin. It was the origin. So if you go back to 1952, these products were sourced from human, and the product was called placenta. Oh yeah. And
so they're like mesenchymal placenta cells. Yeah. Okay, got it.
And then as time went on, it was a strong product and it worked really well. And the question in everybody's mind was, where can we get a similar product? Yeah. Where can we source it that does the same? And they've tried many different sources, and fish was the one that stood out with the closest to human DNA, with reaching everything that it was needed. So the polynucleotide and nucleotides were strong enough to be used in aesthetic medicine. And that's why they decided fish. And there are different types of fish that are used. The two more commonly used are salmon, which are wild salmon in oceans, and a farm trout. So the product that we have here in the UK the brand is called Plinest. So they are, the fish is salmon trout. They've farmed in fresh water in lakes in north of Italy. And the idea is if the fish is farmed, you control everything from A to Z. The life cycle, what they eat, what they do, everything is controlled. Whereas if you have wild salmon, you don't know the life that they have in the open water. They go through a lot of stresses. There is pollutions. There is loads of different factors that you won't be able to get consistent quality of product. Whereas if you're controlling everything with salmon trout, the quality is consistently high, and because the product is derived from fish and human derived, the purification is very important. So it needs to be purified in a lab that is certified that can do this for it in order to be used in aesthetic medicine and injected into the skin.
Okay, makes sense. So basically there's two different sources, one being wild farmed fish, and God knows what they've eaten, God knows what they've been exposed to. And actually I talk about this a lot as well, because I think, we consume collagen as well in terms of collagen drinks. You want to know that what you're consuming is safe.
Exactly.
Like we buy organic, not everything is the same. So organic grass-fed beef is going to be of higher quality than not, of course. Yeah. So the idea of the farmed salmon trout is that there's a controlled environment, and therefore there's a consistency in outcome. Exactly. And then you've talked about the manufacturing process, because that's very important, isn't it? When you're extracting the polynucleotides, they have to be filtered, they have to be purified, and they have to undergo a good manufacturing process, and that's called GMP. And not all labs are the same, we know this. And there's a certification process in the European Union which helps to keep us safe. So tell me a little bit about that.
Yes. So in the European Union, the use of any aesthetic devices, any medical devices, they need to be registered with CE marking, and they need to be produced in a manufacturer with GMP certificate. And these certificates are not easy to obtain, and there is a reason for them, because these products and these injectables are used to treat humans' skin, and the safety is very important, especially these days. We're talking a lot about the safety of patients. So it's always important to use and choose the product that they have got the right certificates. They've got the CE marking. They've been manufactured in a facility that's got the GMP certificate. All of these things are important in order to ensure the safety of the patient. Because if you've got a product that it doesn't have those certificates, you don't know, there hasn't been any check on them whether they're safe or not. Whereas if a product is CE marked, for every batch that they produce, a part of them being sent to a third party for checking them, testing and making sure everything is okay before it's being released for use to treat patients.
Yeah, I think that, the industry regulation is a very interesting topic, and maybe a topic outside the scope of this podcast, but we know that the industry in the United Kingdom is very poorly regulated.
It is.
In fact, there is no regulation. Anybody can inject pretty much anything into the body, which is quite scary. And the CE mark is one of those things that I guess will ensure that there is some sort of rigor and robust process and safety behind it, which is important. It's your face. You only have one face.
Exactly.
Right?
Yeah.
So with that in mind, tell me about where polynucleotides can be used. So we know that they can be used in the face. Personally speaking, I've had it in my face and I've had it in my tear trough, because I had filler a long time ago under my eyes, and then I had it dissolved. And when I had it dissolved, I felt 10 years older. And definitely my skin felt a little bit more crepey. I was shocked. Now that might be because the filler masked aging, and it also might be because of some of the effects of the hyaluronidase. And I immediately wanted to improve the quality of my skin, particularly under my eyes. So I had polynucleotides done around my eyes, and I've had 4 sessions, and it has definitely made a difference. I mean, for sure. There's certainly scope for improvement. I'm definitely not where I want to be, and I'd love to rewind more of my skin aging, but certainly my skin quality around my eyes where I've had the treatment feels much better.
Yeah.
So I know Mastelli and the polynucleotides that are out there. There's different polynucleotides for different areas of the face and of the body, in fact. And it can also be used for hair stimulation. So tell me about that.
Yeah. So if we go back to the idea and the origin of polynucleotide and what they do, wherever there is a skin and there is cell, polynucleotide will work. So just wherever there is skin, it will work. As long as patient or anybody has a skin, it will work. But definitely,
so all you need is to be a human being over the age of 25, really, and have skin, and you're a good candidate. Okay, super.
But one of the main areas that is very popular is around the eyes. If you talk to anybody and if they could pick one treatment in one area that they wanted to make it look better, it would be under the eye.
For sure.
Myself included, if you ask me, the only thing that I wanted to do is treat my under eye, and I'm scared of fillers, so I would never go around it. And the reason for that is, the skin around the eyes is very thin and it's very sensitive, and we sometimes forget to look after it compared to other areas, and the wrinkles get there quicker. We get dark circles. Especially these days with social media and younger people, always on their phone with the blue lights and things like this. So it gets damaged quicker than everywhere else. And not everybody is suitable for tears for filler, because the problem is not the hollowness. The problem is the skin quality. And polynucleotide will work to improve the skin quality. And that's the main action. And as part of that, the skin will thicken, it will look brighter, it will look fresher. And it would feel like you're 5-10 years younger in a way. And that's one of the areas that is very popular because most of the patients are not suitable for tears for filler.
But it's not just under the eye. You can also use it above the eye.
Exactly, above the eye and on the eyebrow as well. So these days, there are a lot of patients that are concerned about thinning eyebrow and they want a thicker eyebrow. So you could use it there.
Have you used it on yours? Because your eyebrows look okay.
Naturally.
This is God-given. Okay, not from fish. Got it.
But I have used it in my hair because although I've got a lot of hair, but I saw a little bit of thinning around these areas. So I have started using it. I've had 2 sessions and I'm starting to see some baby hairs growing out. So it can be used on the hair as well. But it's important to know if somebody is bald and there's no hair follicle, polynucleotide is not going to help.
But that's with all, let's caveat that, because hair loss is a big thing that we treat in clinic. Hair thinning is a big issue for patients, particularly as they move into andropause, perimenopause, menopause and above. It's an age-related degradation. And what will happen is they'll start to lose hair and have thinning hair. Men will have a receding hairline. Women will keep their hairline, but they'll start to thin in the main aspects of their head. And it can be really distressing, particularly for women, but of course also for men. And sometimes by the time men have come to us, in particular, and I would say men leave it a little bit longer than women, they've got these shiny scalps. And what happens is when you start to lose hair, the follicle or the root starts to tighten and tighten and tighten. And eventually it scleroses, which means it closes up.
Yeah.
And that's it. Once that's undergone sclerosis and is completely closed up, doesn't matter how much PRP, polynucleotides, growth factors you inject into the area, that hair follicle's gone. So the sooner you start with hair loss, the better. And of all things, I would say hair loss is paramount to not delay.
Yeah.
Because we're very limited in our time scope in which we can treat it. Unlike aging. I can make a 50-year-old look like a 40-year-old. I can make a 60-year-old look like a 40-year-old because with fillers, with CO2 laser, with polynucleotides, with regenerative treatments. We can recondition the skin. We can precondition the skin. We can completely resurface the skin. We can revolumize. We can transform. We can do transformative things on the face. But with the hair, once that follicle is gone, it is gone. So the sooner patients start hair loss treatment, the better. And it's one of the most distressing things for people to go through. So I think that's a very important point.
That's why, we talk about preventative. Prevention is very important. You don't necessarily need to be bold before you seek treatments. The moment that you see the first sign, thinning hair, that's where you can start thinking about this treatment to maintain it. Otherwise, if it's too late, then you can't do, unfortunately.
Prevention is better than cure for all aspects of health, right?
Yes.
Okay, so tell me, is the actual product different in the hair, the eyes, the face, the neck? Is it different?
Yeah, so in terms of the differences, they all contain polynucleotide, and the ones for the hair and eyes, Plinest eye and Plinest hair, they've got lower concentration of polynucleotide because of the sensitivity around the eyes and the hair. So we don't want to put too much product in there. And there's a product that you use for the face and neck, and that's got higher concentration. And because we're using it on a bigger surface, we could spread it more, and the skin in the face and neck is thicker generally, so they can take it. There is a product that is a mixture of polynucleotide and hyaluronic acid. It's called NEOS, and that's a very interesting one because not only you can regenerate, but you can add instant hydration for the patient. So some people are used to getting treatment with hyaluronic acid for hydration. Now with this option, you have both of them. You get the hydration instantly, and polynucleotide will do regenerative actions in the background. So you get a short-term result and a long-term result together. There's also a product for gynecology, so for female intimate area, and that's very exciting, especially I think these days, everybody talking about menopause and different areas very openly. I think that's important. So
that's called what?
Newgyn.
Okay.
And I see, so if we go back, if we take aesthetic medicine now and go back 10 years ago, we weren't talking about treatments of the skin and face as much as we are today. So I think now people are starting to talk about intimate areas. So in the 5-10 years time, it'll be hopefully a topic that people can openly go to the practitioner and, talk about different things and get help for that area as well.
So what does it do?
Don't
feel shy. It's okay. Talk openly. It's fine.
So it helps with the dryness, and some females complain about sexual pain as well, and again, the skin quality as well. So I don't know too much about it. I'll be honest here.
Okay, you stick to your scope of practice. That's why your area of expertise. So I heard about Newgyn in the latest Menopause and Aesthetics conference a few days ago, and a lot of people are using this to condition the skin in the female intimate areas. And yes, they help to improve thickness of the tissues and collagen production. Again, remember, collagen is not just for the aesthetic outcome, but also for wound healing. And what a lot of women, particularly menopausal and above, start to notice as they get dryness, they're more prone to infection, poor wound healing, pain, discomfort. And so that will help with that. So it helps from both a functional element, reduction in pain, improvement in function, but also, of course, aesthetic. So it has this dual modality approach. We do offer it in the clinic. I don't inject it because I believe that you must stick to your scope of practice, and my scope of practice is head and neck. But I have a gynecologist and a GP with special interest in female intimate health, and they do the treatments in the urinogenitory area. So if anybody wants that, they can come and see one of our practitioners, one of the doctors on the team. So I've understood from you that there are different concentrations that can be used in different areas. And what about complications? So
complications, it's a very rare thing with polynucleotide. In fact, with Mastelli's polynucleotide, because we know it, because we know the way that it's processed, there hasn't been a single adverse reaction so far.
Okay.
The only thing that would be is the downtime or side effect from injection. So bruises, swelling, normal things with any injection that you would do. But in terms of any adverse reaction, there hasn't been any recorded directly from polynucleotide. Now, I have seen some other ones that patient complained about different things, but with polynucleotide treatment, but they have been used with a different polynucleotide that they come from China or Korea, and they have been treated by non-medic. And this is again going back to regulation, and it's important to talk about it all the time when we get opportunity, because it's important for patients to know when they go for a treatment, always choose a practitioner that is medically qualified and they've got all the certificates. They've been trained professionally to do the treatments that they want to do, and never be scared to ask about the products and see the product. Does it have the CE mark? Where does it come from? Does it pass all the certificates that it needs to for it to be injected into the face or a skin? So generally speaking, I haven't seen any adverse reaction with the polynucleotides that we know from Mastelli, and they've been producing them since 2005 for aesthetic medicine.
So when you talk about looking at the box and the differences, I mean, is it a big deal? Is there a big difference between, because there's a lot of different brands out there, and I think we should just openly talk about that. In my clinic, we use Dermafocus, the Mastelli products, for a number of different reasons. One being the farmed trouts, salmon trout, knowing that there's consistency in each product, so that when I'm giving every single patient the treatment, I know that I'm giving the same quality every time. But also, in terms of CE marking, I am comforted by the fact that it is regulated and rigorously tested. So there's a lot of different products out there. What's the difference?
So of course, with anything that becomes popular, then everybody start thinking about them and say, can we have a version of that? Can we have a version of that? And there are now in the UK, I think about 3-4 different brands.
Okay.
Mastelli is the oldest and the most established brand of polynucleotide, since 2005. And they've been doing this for a long time in aesthetic medicine, but generally on polynucleotides for more than 70 years. Any other brands, they've been in the market for less than a year. And is there any clinical studies done with those brands? Probably not. Has there been any check on the safety of products? Probably not. So it's important, if for practitioners, they need to do their research and always work with a brand that they can showcase a strong clinical evidence for the safety and efficacy of products, with loads of clinical studies that have been done with that brand. If there is a product that doesn't have any clinical studies, so how can you trust it? If it doesn't have the CE marking, how can you trust it? Would you put it in your own skin? So you need to think about all of these things.
Okay, so that's kind of like a public health message, so to speak, is ask about the product. How long has it been around? Does it have rigorous testing or has it been tested by any regulatory or independent parties? And are there any clinical studies around it? Those are really wise points. May I ask you, in terms of injection areas, we've talked about skin. Is it only in skin that it can be used? And is that the layer of the face that we are targeting?
Yes, for aesthetic treatment, yes, we're treating on the skin, but there are products for orthopedics and wound healing, and they will be injected in different layers to treat different things. But for aesthetic medicine, it always has to be injected intradermally. So it's not going to work topically.
Yes.
If you inject it too deep, it's not going to work. So it always needs to be injected into intradermal layer of the skin.
Got it. So the target is the fibroblast. And therefore, in terms of injection technique, really we're aiming at intradermal injections, which is why when we're teaching, I'm a trainer and educators, we're teaching ideally intradermal injections over the use of microcannulas. Because with microcannulas, it's much easier to glide underneath the skin rather than in the skin. So that's a really, really good and I think vital, important point, because a lot of people get hung up about that and confused about it. And naturally, if we prick you, you may bleed. And if you bleed, you may bruise. There's a risk of that. So the treatment is injected and then you have 3 to 4 sessions, usually 14 to 21 days apart. And then how long do the results last?
The result will last so you would need a a session after 6 months after the last course of the treatment. So a maintenance session every 6 months.
Okay.
Not to repeat the whole course, but every 6 months you just need a maintenance.
Okay.
And the good thing about polynucleotide is the results are cumulative. So after 6 months, you're not starting from
scratch.
You've already have improved. So you just need to top it up. And we are aging every day. So there is nothing that can stop aging.
Of course.
So every day, we go through the environmental pollutions and sun damages and everything. So we need that maintenance session every 6 months to keep the youngful and youthful
look. Okay, I think people often think that we have a magic wand and we can press stop, but we can't quite. Okay, lovely. And can you have too many? Or, if I wanted to keep going, could I? Or am I going to look like 5 years old?
No. So I think that one of the key difference of polynucleotide with any other treatments is, I would say polynucleotide treatments are therapeutic. So it's not aesthetic treatment. So with botulinum toxin, with dermophilus, you can have 2-3 times, and you can't do more than that. But with polynucleotide, it's a therapeutic. You can continue to do that because you're working on the skin cells and regenerating the skin cells, and you could do that. And it's important because polynucleotides, they balance all the molecules that we have in our skin. So by working on fibroblasts in both in quantitative and qualitative measures, we are balancing the hydration, we are balancing the collagen, we are balancing elastin and everything. So everything is balanced out. We don't have too much of one thing and too little of another thing. So that's an important thing as well. So I would personally have it every 3 months.
You would? Okay, fine. That's good to know. So we're not going to be Benjamin Button and keep going. No. Not that I have any complaints if that happens. I'm happy to look like, my 12-year-old self, my former self. That's amazing to know. Thank you so much. I think, this is such an exciting space. Regenerative medicine is growing massively in the aesthetic industry. And I think we've only just scratched the surface. I am sure that we will find new innovative ways to use polynucleotides for wound repair, healing, collagen stimulation. We know that it helps with reducing oxidation as well, because as you say, every single day we're exposed to the environment, the oxidizing free radicals that actively age us, pollution, sun damage. And we know that polynucleotides actually scavenge up those free radicals. So there is a protective mechanism that comes from polynucleotides as well. So it's very, very exciting. I'm excited to see where this develops. I am a trainer for polynucleotides, so there's a lot more to come in this space. So watch this space, my friends. And thank you so much, Milad, for coming.
Thank you for having me. It's been a pleasure speaking with you.
Until next time.
Until next time.